So today we have with us Dr. Namrata Ranganath. She is a professor, Kidwal Memorial Institute of Oncology, Bangalore. Good morning, madam, and welcome to ISO MVR CanCon. So I would like to take this opportunity to know your opinion about the relevance of oncoanesthesia as a subspecialty, madam.
Oncoanesthesia, actually I've been in oncoanesthesia from last 28 years, and the biggest thing which I find different here is the patient. The patient himself will come up with so many comorbid conditions, the frailty, he will be not nourished properly, he would have undergone treatment with chemotherapy, radiotherapy, he may have some hematological abnormalities like deranged hematology, he may be in a hypercoagulable states, the tumor itself, the tumor biology, and even the tumor may be secreting some kind of hormones which is like, which can cause paraneoplastic syndromes. So all this makes it very challenging for the anesthetist to get a better perioperative care for the patient. So he needs to know all these things to treat all these things. He needs to make sure that when a patient comes, he's prehabilitating these patients very well, because as I said that they would be undergoing so many treatments and all, he should rehabilitate them. He should make sure that he uses some kind of anesthesia which causes less cancer recurrences. He should know how to handle the ERAS protocol, get the patient earliest to the return of the intended oncological therapy, and not even general anesthesia inside. He needs to make sure that he doesn't develop chronic pain, has good control of the acute pain, and integrate the critical care palliative medicine also. So this is what is totally different in this kind of anesthesia, which I feel the anesthesiologist should be trained for.
Okay, madam, is there any training available for the same?
So we have really involved in these last few years. We now actually have a specialty called oncoanesthesiology, which we have institutes which are running DM oncoanesthesia. We have fellowships which are endorsed by what do you call the society itself, by DNB, and we have Indian College of Anesthesiologists fellowship in oncoanesthesiology also, which range from 1.5 years to 2 years to 3 years, the training process after MD. So these are the kind of training which I feel the oncoanesthesiologist requires. And as all of you know, that the number of cases are increasing so much, and we are getting more patients on operation theatre.
Madam, do we have any association of this oncoanesthetists in India?
Yes, we are a good society now. It's about 6 years old, and we just had a conference in Bangalore for this, and which was hosted by us. I'm so proud to say that. And what the society really brings to us is that all over the India, not even India, we get the international faculty also, where we exchange our ideas, what we can do to improve, because what we are doing now, maybe 2 years it changes. So whatever is updated and all we learn there. And not only yearly we meet, we have a webinar every week where we exchange ideas, and it is open to the public to even ask questions and clarify their doubts. And we have a YouTube channel where most of the surgeries where the talks are uploaded, and whenever any anesthesiologist wants to know about any difficult cases, they can just go to that YouTube and learn from it. So I would say that yes, oncoanesthesiology is, I would not say a upcoming branch. It is, and it is right now we have emerged as a specialty, and we need to train more people so that patient gets a better care.
Yes, and I hope this branch of oncoanesthesia gain more prominence in the coming years. Madam, thank you, madam. Thank you for taking the time to speak with us.